presentation, I would like to tell you all a story about a woman named Mary. Mary was a 75-year-old woman at a nursing home, and one day she was getting ready to play bingo with her son. So she couldn't find her glasses, and she called in her nurse to come and help her find her glasses. A few days after that, Mary began to experience nausea, watery diarrhea, and fever, and a few days after that, she passed away. Hi, my name is Mobolawa Adio, and the disease I will be presenting today is Clostridium difficile infection. Today we'll be talking about the introduction, history, symptoms, risk factors, transmissions, preventions, treatments, experiment, summary, and conclusion. Clostridium difficile is a bacterium that's located in the colon. It's usually not a big problem until the bacteria begins to overgrow and disrupt the other bacteria in the colon, causing the colon to swell and leading to an infection. Clostridium difficile is classified as an anaerobic spore-forming bacteria that can live for long periods of time on surfaces. It's also accountable for 14,000 deaths in the United States. In rare cases, Clostridium difficile can turn into something else called extraintestinal Clostridium difficile infection. This is when Clostridium difficile occurs outside of the colon in other organs. This can be a very deadly disease. An experiment was conducted by Uromatilla, and he found that 31 patients were found with this disease, which shows how rare this disease can get. Clostridium difficile infection was first recognized in 1935. It was named Bacillus difficilis by Hall and O'Toole because of how hard the bacterium was to cultivate. In the late 1960s, an antibiotic for this disease, clindamycin, was first introduced. Dr. Tedesco decided to give his patients this antibiotic, and he found that it started to cause diarrhea, which is one of the symptoms of Clostridium difficile infection. Between 2000 and 2007, the mortality rate for this disease increased because a stronger strain of Clostridium difficile bacterium was found. Symptoms. Some of the symptoms include watery diarrhea, fever, loss of appetite, nausea, abdominal pain or tenderness, and dehydration. Blood or pus in the stool, kidney failure, and increased white blood cell count. The risk factors for this disease include hospitalization, the use of antibiotics, and if a patient's age exceeds the age of 65. Secondary risk factors include smoking, nasogastric tubes, acid-reducing medications, autoimmune diseases, HIV, inflammatory disease, renal disorder, and organ transplants. The transmissions for this disease are in hospitals, nursing homes, infected surfaces, healthcare, and it can be transmitted from healthcare personnel to patients. Prevention methods in hospitals. Hospitals can take infection controls, such as wearing gloves or gowns while treating patients, administration of antibiotics by only doctors or nurses, and they can use spore-killing disinfectant sprays to kill bacteria. Prevention methods for patients. Washing hands after using the bathroom, informing your doctor if you develop symptoms such as diarrhea, nausea, or fevers, and taking antibiotics as prescribed by your doctor. Treatments for this disease include antibiotics, discontinuation of the antibiotics if you're on antibiotics 3 or 4 months before this disease occurs, or a fecal transplant. Okay, experiment. experiment was to observe the similarities between humans and cows, and to observe a distinct pattern between human and cows in Clostridium difficile infection. It also was to observe diarrhea among calves. A questionnaire was given to each farm about how they treated their cows. And fecal samples were collected from each farm and put in a scoring system. And the highest being 4, which was watery diarrhea. Each sample was screened for toxins and compared PCR ribotypes. Okay, the results. 7 similar PCR ribotypes were found among humans and calves. Cryptosporidum was the reason for diarrhea among the calves, not Clostridium difficile. And the farm management practices did not affect the result of the experiment. And they found that the month the samples were collected and the age of the calves did affect the result of the experiment. And older calves were found with more Clostridium difficile infection toxins than younger calves. Summary. Clostridium difficile was first acknowledged in 1935. It's caused by a disruption of good bacteria in the colon, which leads to the colon swelling, which leads to an infection. Some of the symptoms include nausea, fever, diarrhea, and high white blood cell count. It can be transmitted through infected surfaces, from person to person, and through prevention methods include disinfecting surfaces and washing your hands after using a bathroom. And antibiotics is one way to treat this disease. In conclusion, it was found that Mary died because her nurse had Clostridium difficile infection on her hands, and she gave Mary the disease, and Mary passed away because of the disease. So, don't forget to wash your hands and be careful what you touch. Thank you.
Jazz hands. Raise your hand if you have a question.
Well,
what is a fecal transplant?
it's when you take a healthy stool and put it inside of an infected patient. Corey?
Okay, if somebody gets this disease, can they like get it again?
Yes, they can. Maya?
So you listed some antibiotics that could be used to treat this disease, but which one is most common?
Vancomycin is most common to use to treat this disease. Oh, it's me.
You said that there